with erectile function, because you need to get the blood there to achieve an erection and maintain an erection. And so that's an important, useful piece of information for my patients that come in and tell me, you know, when I use Viagra, I can have an erection, but I can't do it without it. That's important to me. That tells me that we need to work on circulation, and I'm also concerned about blood sugar. 15% of people with erectile dysfunction have undiagnosed diabetes. So that's incredibly important. That's a very strong message to your body that we want to interpret and really work on that diabetes, that blood sugar issue, because if you have abnormal blood sugar swings, that can affect your mood, which can affect your ability to perform. It can also affect your circulation. Oftentimes I refer to diabetes as a disease of the cardiovascular system because it causes oxidative damage. What that means is that when your blood sugar spikes high, it damages your cardiovascular system and circulation becomes more difficult, and you can also develop atherosclerosis, which is the building up of plaques or the hardening of your arteries. And so that's an incredibly important underlying cause. And while some men may not want to live if they're unable to have an erection, to me as a physician, the most important thing, even more important than having an erection, is going to be, I want to have you live until you're 90 and or till you're 100 and have a long, healthy, fulfilling life free of blood sugar disease, free of cardiovascular disease, and probably being that horny old man at 90 that can still perform, right? That's what most men, I think, want. And so this is what I'm going to help you with today. So one important thing to do if you're starting to have erectile dysfunction is to pay attention. Did it start suddenly? Or has it been something that's been gradually coming on? If it's a sudden change, important things to ask yourself are, did something change in your life? Is there an emotional component? Because while most men may not want to admit it, there's a very emotional part to having an erection. And if you're under severe stress, if you just lost your job, if you're in an unhappy relationship, then you may not be able to maintain or achieve an erection in that situation. And one way that you can differentiate that is when you wake up in the morning, do you have an erection? Because that's a physiologic process that often happens with men. And so if you're able to wake up in the morning with an erection, but unable to perform later with your partner, or if you're able to have an erection in masturbation, but not have an erection with your partner, that tells me that there's something going on in terms of stress, but also maybe stress hormones. There could be a physiologic component to it, but would take a different course of treatment and ways of approaching that than I would for someone who has a circulatory issue or maybe a prostate issue, the other concerns like that, where it would be a different treatment route. So if you have a sudden onset and nothing changed, you're feeling great in your relationship or just with whoever your sexual partner is, you don't have to have a relationship, right? But if that hasn't changed, stress is okay, nothing suddenly has happened, then it is important to go see your physician to get a full check. Now, I don't want to scare you, but a sudden onset of inability to have an erection, we're concerned about nerve issues, nerve damage, concerned about possible cancer. It's a small incidence, but as a doctor, I always think worst case scenario, and I want to rule out those big bad things before I feel really comfortable treating on a herbal level, right? And so sudden onset of erectile dysfunction, pay attention, is there a situational change? If not, you need to go in and see your physician and get some lab work done to rule out some of these big bad causes, as well as some of the other causes could be kidney issues, which is also an issue with circulation. It could be thyroid issues, people with thyroid disease, low thyroid, that can cause erectile dysfunction. And as I said, blood sugar issues as well. All of these can contribute to that. And so now let's focus on one of the most common causes of erectile dysfunction is going to be people, so it's been coming on gradually over time. A definition of erectile dysfunction is at least 25% of the time that you're trying to initiate sex, either the inability to achieve an erection or you're able to achieve an erection but unable to maintain it. And that doesn't count if you're drinking 25% of the time. That doesn't count. Alcohol can impair one's ability to have an erection. So that would be a whole nother issue to treat. But if it's not any sort of drug or alcohol use, as 25% of the time you're unable to do that or more, then we're dealing with an erectile dysfunction. And so then the next step would be figuring out what the cause is. So unable to get an erection in the morning and unable to perform, now I'm thinking more circulatory issues. And so what we want to do, generally, if you were a patient coming in to see me, I'd want to do some blood work, and I'd want to check things like your thyroid. I'd want to check your blood sugar. I'd want to check your cholesterol, and I'll talk to you a little bit about cholesterol because it's not the big bad thing that everyone's telling you it is. Cholesterol is incredibly important, and it's actually a key part of this treatment, but I still want to know where the levels are. And part of that would be if you're grossly cholesterol deficient, if you're on a statin drug and your cholesterol levels are abnormally low, that can be a major issue in your hormone production, including your testosterone, because cholesterol is a precursor for all of your hormones. It's that base building block to make all of it. And so if you're low, it can be an issue with depression. It can be an issue with hormones. You might be experiencing fatigue. For people that are admitted to the hospital for depression, if they see that the cholesterol levels are abnormally low, then the sort of standard protocol is to screen them for suicidal depression, because it's recognized in mainstream medicine that low cholesterol can have that much of an effect on the body, as well as your hormones. People with low cholesterol often have fertility issues as well. And so that's something that's going to be really important. So I want to check your blood sugar, your thyroid. I want to do a blood cell count and just make sure you're not anemic. Make sure that there's no infections going on. Prostatitis can be an infection that can cause problems. There's a whole lot of things to look for. And then what we want to do is, if we've gone through all of that, and let's say your blood sugar, your fasting blood sugar is maybe in the 90s or higher, that's a sign of some blood sugar dysregulation. And so that means that we're going to want to start doing some of the nutritional interventions, both dietary, so avoiding refined carbohydrates, so things like breads and pastas, also sugars, obviously, no white sugar, staying away from the cookies. All of those things can be a really important step. And for some men, it may be a choice of, do I want to have my cookies or do I want to have my cookies, right? But that it really can be that. Do you want to live with diabetes and erectile dysfunction, or do you want to be healthy, energetic, and sexually vital? So that's an important choice. And for some people, that's the thing that makes them change their lives. So kind of continuing with this sort of workup that I do with patients, the next thing that we do is making some basic dietary changes, and then also if there's a situational issue where I'm thinking there's chronic stress, they're in their 50s, they've been working, I'm worried about their stress hormones and maybe their testosterone levels. Sometimes we'll test for testosterone. Sometimes you can just tell. Someone comes in and they're reporting a lot of the symptoms of low testosterone and in general low androgens, which are some of your sex hormones, a group of hormones. The number one thing that you can do, and I tend to have people, I create a treatment plan that says, here's the low-hanging fruit. Here's the obvious one that is going to make a difference for most people. Then, okay, well, we've tried that. We've got that foundation on board. Here at step 2, 3, 4, and 5 of what else we can do that's going to continue to refine it down and create a customized treatment plan for you and your specific message that your body is trying to tell you. Number one thing is starting with supporting healthy cholesterol. So I want you to start with eating 12 eggs. That might seem like a lot. Here's a couple reasons why that's going to be helpful, but 12 eggs a day. And ideally, I want you to space it out throughout the day because it's going to hit a couple different targets for you. One, I want them to be runny eggs or raw eggs. That's because it's going to be more bioavailable in terms of getting that hormonal precursor that's in those egg yolks, and it's full of nutrients. If you get a good organic free-range egg, or if your neighbor down the street has chickens, they always have a sign up, eggs for sale. Get those eggs. It's going to be a nice bright orange color. The yolk is going to stand up when you crack it. You don't want to get the egg that you can buy at the grocery store where the shell's really thin and the egg is a light pale yellow color, because that's not going to have all the nutrients that you need, and it might be actually pro-inflammatory. You want an anti-inflammatory support for healthy cholesterol and healthy fats in your body. So getting a good healthy egg, 12 of those a day. Now part of what that's going to do is going to be supporting the hormonal support, and that for most people is going to make a huge difference. The other part of that is going to be, if you're eating 12 eggs a day, that's a lot of food into your body, and that's an excellent source of protein. So it's going to be replacing, we're going to be taking away some of those sugars, some of those refined carbohydrates that are probably part of your diet, and very hard if you've been eating the standard American diet, if you were raised on pancakes for breakfast, peanut butter and jelly for lunch, and then pasta for dinner. That's a lot of carbohydrates, and carbohydrates turn into sugar in your body. Most people may think, I don't understand why I have blood sugar issues. I don't eat any sweet stuff. I don't even like that. But they're eating chips and bread and pasta and all these things. It just turns into sugar in your body. So it's going to be helping with maintaining a level blood sugar by getting small protein snacks throughout the day. And it's also going to be giving that hormonal support. So that's the number one tip that I can give you in terms of improving your erectile performance, in terms of being able to achieve and maintain an erection. So if that doesn't make a difference, then we want to start thinking about other issues. Do you have digestive issues? Do you chronically suffer from diarrhea or constipation, gas or bloating? Then that is a suggestion that your body isn't able to absorb the food that's coming into your body. And so then we need to look at, okay, is there a food allergy? Is that a problem? We might want to look at an elimination diet. Or a lot of folks, we might just want to start with digestive enzymes. So taking digestive enzymes with your food, especially if you've had your gallbladder removed, you need to be taking a digestive enzyme that has ox bile in it, because your body isn't able to produce the bile in the quantities that it did with a functional gallbladder. And you need the bile to break down fats and absorb fats, emulsify them is what we call it in medical language. And so what you want to do is make sure that you're getting those digestive enzymes so that you can absorb all those nutrients that are going to be in the eggs and in the rest of your diet, as well as especially those healthy fats and cholesterols. And you may see a lot of other improvement in your body. What I expect to see, and what I see with a lot of patients when we're working at underlying cause, is they lose weight. They feel more vital. Their energy is improved. Life is better, and it's not just because you're waking up in the morning ready to engage in some fun activities with your partner. So it's a complete life change. The next thing that we want to work on is, if it continues to be an issue, the eggs didn't do it, you're looking to do something else, or if you just want to do the full treatment plan all at once, then the next things we want to do is focus on blood sugar regulation as well as circulation. And so in doing that, we want to make sure that you have all of the vitamins and minerals that your body needs for healthy circulation and healthy cellular function. And so what that means is oftentimes doing a good foundational multivitamin, and also increasing your calcium and magnesium, chromium, vanadium, all of these things. That is helpful because it is targeted towards the cardiovascular system. So it's going to help with circulation. If there's a blood sugar issue, maybe adding in some chromium, some sweeties is the product that we do. If you have diabetes, or if you're close to diabetes, doing both of those things. So that's going to be a foundational part of the protocol. Making sure that your digestion's on board. If you're having those symptoms of digestive issues, constipation, diarrhea, gas, bloating, then adding in some digestive enzymes as well. Increased essential fatty acids. I talked about the importance of fats, healthy fats for hormonal production. It's also going to be anti-inflammatory. Inflammation can cause a lot of issues with circulation, and so we want to reduce inflammation as well. Now, if you're a man and you're starting to get older and having erectile dysfunction, we also want to focus a bit on the prostate, making sure it's not an infection. But if it's not an infection, if it's benign prostatitis, adding in a prostate support, something which has saw palmetto in it at a very robust dosing. When I treat people for prostatitis, benign prostatitis, they normally will see improvement within 1 month of treatment. And so that's going to be improvement in terms of force of urination stream, frequency of urination, and also we'll start to see improvement in terms of the erectile dysfunction if that was playing a component. Because if you have prostatitis, it can also cause erections to be painful, and that's going to be even if you're not aware of it, a psychological deterrent for having erections. Additionally, the next layer of treatment for that would be supporting the hormone side of things. So especially anyone living in Western society, at some point, almost all my patients I see have some level level of adrenal fatigue. I can go in, you'll see more talks about that, so we're not going to go into it too deeply, but essentially it's when your stress hormones have been stressed out for too long. And if you were to look at a chart showing how to make all of your hormone production, it starts off with cholesterol, then it shows pregnenolone, and then it goes down and shows all of your different hormones that your body makes: testosterone, estrogen, DHEA, cortisol, a whole bunch of different hormones. And so all of these together, if you've been using too much cortisol, which is a stress hormone, then you're stealing all of the building blocks for that. You don't have enough to make testosterone. And so what we want to do is do the hormonal support, which is also going to help maybe some of the psychological factors that can be playing a role. If you have too much stress, if you're just feeling too tired to feel arousal, to feel desire, then treating the stress, the adrenal fatigue, can be a huge issue. And men, something to pay attention to for this is you might want to think about this for your wife, especially if you've had children, especially if she works. Sometimes the psychological component can be because you're being turned away enough times and no one likes rejection. And so if it's because your wife is tired and has adrenal fatigue, you might want to gently talk to her about supporting her energy. Now, I recommend starting this conversation with, baby, you seem like you're really tired and I really want to help. Don't even talk about the sex part. But most of my patients, one of the side effects that they see, for my female patients of treating their adrenal fatigue issues is increased libido, increased desire. And so if that's a psychological component for you of knowing that when you make an attempt to engage in sexual activity with your partner and she turns you down, she's becoming more of a life partner, raising children, perhaps building a home, whatever sort of partnership you have, but not an object of sexual desire anymore. And so you can change that by helping support her and the health messages that she's getting for her body. So in terms of also supporting your hormonal support, besides the adrenal end of things, which oftentimes I'll treat either with good herbs, either the hypopituitary, hypothalamic formula, as well as the male hormonal support formula, which actually for erectile dysfunction would probably be the place to start unless high stress is an issue. The male hormone support formula would be an excellent one for that. In terms of the protocol that we've been talking about, so number one, just start with the eggs. Easy to do, gonna improve a lot of things for you. Number two, making sure that digestion is on track, that you don't have any digestive issues, that your body's not giving you a message saying, hey, something's going on down here. Because what we're trying to do is underlying cause. We're not trying to mask a symptom, which was what would happen if you were using a prescription drug. You might have an erectile dysfunction because you have undiagnosed diabetes and your body's trying to tell you, hey, this is going on, let's work on it and try and improve it. But if you mask that by taking a drug, then your body's going to have to speak louder to get your attention. And then it might be that you become insulin-dependent diabetes, that you go into a diabetic crisis, that you have kidney failure, all of these side effects of diabetes because you didn't listen to the first message. And so we don't want to suppress the symptoms. We want to listen to them and address the symptoms. And so that's the foundational part of this. So digestion, and then making sure that you have all the nutritional precursors that your body needs. So that healthy body, brain and heart pack is going to be important for that, as well as adding in some of the hormonal support on the next layer. So the HGH youth complex, as well as an adrenal support, something like the Good Herbs male hormone support tincture. And then making sure that there's the psychological issues as well are addressed at home, making sure that the setting's right? So making sure that your partner is well supported, that any other outside stressors that might be affecting you are recognized and addressed, and that we're able to support you in not only having a healthy sex life, but enjoying fully all of your life. Wouldn't it be amazing if you could listen to your body for one symptom and improve and change your entire life? And that's what we do with naturopathic medicine. So if you want to start this protocol, if you want to change not only your sex life, but your entire life, then go to takeyoursupplements.com now, and one of our representatives are going to help you get started. They're going to give you a call back and help you create a personalized plan for you based off of the things that we've talked about today. I'm Dr. Megan Saunders, and I'm so excited to be working with you to change your life and improve your health. Hi, I'm Dr. Megan Saunders, and I'm here today to talk to you about erectile dysfunction. Now,